All right, so it's week 6 of our 13-week program. Week 6 is midterm, and our students are also tested on a room setup for composite procedure. As we know, 10 different doctors, 10 different setups, but we're teaching the basics of the setup that are standard across the board. What brand of product, what self-etchant bond you use is completely the choice of your doctor, what kind of burrs, things of that nature. So I'm in a classroom setting. I'm not doing things fully gloved. I'm not working on any patients here. And my instruments are already opened. Again, this is an education setting. This is not a true setting of a dental practice. If it is, we want to make sure that our instruments stay in a bag, in the sterilized bag or your sterilized cassette before your patient enters the room, right? We want our patients to be confident that the instruments that we're using in their mouth is newly sterilized, not open, not used, or being questioned, is it used on the previous patient? So let's talk about that room setup today. So first and foremost, we need our PPE, right? As a dental assistant, we greeted our patient, Miss Helen, hi, come on back. I see you're on the schedule for a filling today. We're going to do a filling on the lower right. My name is Amanda. I'm the dental assistant today. I'm going to be assisting the doctor. Any changes in your medical history? Can I have your date of birth, right? We want to verify that we have the right patient. Have the patient sit in the chair a few minutes, relax, the hustle bustle, but in getting it back to the appointment. A lot of our patients are nervous. So we want their heart rate to come down a little bit. Maybe they were in traffic to get to the appointment, and then we want to take their blood pressure. We want to take their blood pressure, make sure it's in a good, healthy range for the procedure to be done today. And of course, we want to document that that procedure was, that medical history was reviewed, make any changes accordingly, and what that blood pressure was prior to the start of the procedure of the injection. So once we have that patient in the room, then we want to make sure we have our mask. And of course, we want to make sure we have glasses. And then we want to make sure that, of course, we're utilizing gloves for said procedure setup. Again, this is an education setting. My instruments are already prepared. So what do we need in the sense of that room setup? Of course, we have uh, our unit here. Our unit consists of our suctions. So we want to make sure we have our saliva ejector connected. We want to make sure we have our HVE connected. We have our hand pieces prepared. They can be on just the counter is fine, or you can have them set up on your unit as such. And when we want to have a burr block, of course, our burr block still is also should be in a bag and sterilized. If your office is using disposable burrs after a one-time use, then these need to be in a cabinet, in a concealed cabinet, not open on the countertop. And of course, if we're going to take an x-ray, that I have my XCP setup available still in my sterilization bag. I'll do a video next on just a refresher reminder about how to set up these XCPs. So my unit is ready. I have my tray paper, and I could have a piece of sticky barrier tape here on the handle where my doctor maybe would commonly pull that unit closer to where is necessary. So always an option. Remember, barriers are to be replaced after each procedure, after each patient. Barriers are not kept on and wiped with a cavi wipe. Big old no-no. All right, let's talk about our tray setup here. I'm going to switch sides. On my tray setup, of course, I have my instrumentation. And remember, let's set up that procedure in the order with instrumentation that our doctor is going to use it. It helps keep us uniform and also sort of like a checkoff list, even for ourselves, even myself after 23 years, that I have everything that that doctor needs, right? Our doctor is stepping in for that appointment to do the procedure, to perform the dentistry. Our role as a dental assistant is that when the doctor steps in, that everything is ready for that procedure to be performed. So first and foremost, unfortunately, we need to get numb. So we have our syringe. I have my syringe ready. It's common that your doctor uses the same size needle on the maxillary and a different size needle for the mandibular. If that's on your schedule, get that syringe ready for when that doctor steps in. that he or she then can place that topical, and then you have your syringe ready to go for injection. My next three instruments are our basic setup. Our basic setup is going to consist of course, our mirror, our explorer, and our college pickup or cotton pliers, whichever you call those. So we have those three instruments. I have a spoon here on my tray. As we know, that's a tiny, tiny, tiny spoon. And then I have my two instruments that are considered my composite setup instruments due to they are coated in this gold. Your composite instruments could be a black coating, they could be plastic. And the reason they're coated is so the instrument does not stick to the composite material and kind of do that bubblegum effect, that bubblegum pull. We don't want any air bubbles that's created maybe in that 12DO, if that's what we're doing. Speaking of tooth number, we want to have the proper matrix. So if we're doing a posterior, we have to use that Toffelmeyer. Personally, I'm not a fan. Even as an EFTA, of course, you're going to need a Toffelmeyer band. And for our midterm testing, you're going to have to set up this Toffelmeyer based on what tooth number that our instructor gives you. So if it's the upper right, number 3 MO, then you're going to set that Toffelmeyer up for such. Or, of course, that Toffelmeyer needs set up differently if it's an upper left. So go back and watch that video that John has already made on that Toffelmeyer setup as well. But if you're doing an anterior film, remember all we need is that Mylar strip. So we need a Mylar strip if we're doing maybe a number 8 mesial facial. So the Mylar is for an anterior, our Toffelmeyer, the metal, is for a posterior. So of course, outside of instrumentation, we also have an articulating paper. Actually, mine's not sitting there. So I have the articulating paper out and ready. And yet again, I want to have the articulating paper on my articulating paper forceps. Yet again, why not have it prepared? And then what products do we need in order for that doctor to fill the tooth with the filling that's being placed, as we're talking about here and practicing as that composite resin setup. So what is our first and foremost? First and foremost, we're going to have an etchant. Our etchant stays on the tooth for about 15 to 20 seconds. We rinse, then dry. Once our tooth is dry, after we rinse and dry the etchant, the tooth can no longer get wet with blood or saliva. Our composite resin material is called a hydrophobic, hydro meaning water, phobic afraid. So it cannot get wet with dampness with blood or saliva, or otherwise it's not going to be a acceptable filled. It's not going to stay in the tooth. It's going to have a lot of postoperative sensitivity if it has dampness, all these things. So etchant, the etchant tip is changed after every patient. The etchant tip is changed after every patient. As I can see, there's etchant in the tip of this blue tip that is replaceable. So I know that this etchant tip has already been used. Yet again, this is an education setting. This is not used on a patient. We've used this on a typodont, but we want you to be aware that any tip like this is a disposable one-time use. So etchant, 15 to 20 seconds, rinse, dry. Keep dry from that point on. Second, we have a bond. There's Optibond Solo, there's Viva Bond pens, there's all different types of etchant and bond, I'm sorry. The bond is then, if you have a bottle as such, you need some sort of dapping dish and a micro brush. So obviously you would place your one drop in your dapping dish, and then you would need your micro brush in order to place that bond on the tooth. Once the bond is placed, as the second step, you as the dental assistant or your doctor is going to do a light air dry, and then you're going to light cure. You're going to light cure that bond from 5 to 10 seconds. Again, you want to check your settings. That beep on those curing lights are great. So your third step then is some form of composite. Here we have an example as a flowable. Remember that flowable is a little runnier. I always say like melted butter to get down into those nooks and crannies of your English muffin. So your flowable is really going to flow into those maybe pits and crevices that we can't completely see. And then we have a packable composite I love this composite gun from Kerr. This is my favorite as an EFTA personally. So this is a composite in your heavy compule. Of course, I have a tip on here as a new compule that's used for my patient procedure. Outside of that, of course, based on your tooth number that you're working on for midterm purposes and testing, that we want to practice that XCP setup. So we want to have our XCP set up to take an x-ray. Let's say on number 3, the patient comes in as I'm talking to Helen. Number 3's been bothering her, a little bit of sensitivity when drinking hot tea in the morning. So we're going to take an x-ray for that doctor to evaluate that tooth to make sure that there's no underlying issue. Maybe the cavity is not deep or is deeper than what was initially planned. Of course, not making sure there's an abscess. Remembering that us as a dental assistant, we are not treatment planners. But we are able to take that x-ray, and then that dentist will come in, read that x-ray, evaluate with the patient on if there's any other treatment that is necessary. Outside of our instrumentation and our products for our procedure, we need things for like moisture control, like cotton rolls, maybe some dry angles, some gauze if that's the case, in order to keep our instrument clean. So refer back to our PowerPoint slide that shows you your setup. But I know you guys will do great. If you're watching this as a new dental assistant, I hope it's helpful as well. And thank you so much for watching. Again, I set up every procedure in the order that my doctor needs it. I learned that in my first role as a dental assistant in an oral surgery office, that the syringe was first, the Minnesota was second, then the mirror, an explorer, an elevator, periosteal elevator, things like that for an extraction. Set it up in the order that your doctor needs it, and it'll help with your organization during your process, especially in those early stages of being a dental assistant. And unfortunately, a little bit of that fumble jumble with the procedure and just navigating it all. It's a lot. So give yourself some grace. Watch back the video, look at your slides, and practice your setup here. Thank you so much.